Hi, this is Michael Harris. I'm an author on a new paper in JBJS titled Identifying Risk Factors for Disease Progression in Developmental Dysplasia of the Hip Using a Contralateral Hip Model. And here are some of our author insights. So two questions really led us into this research. The first is just fundamentally, can we use the contralateral hip in patients with hip dysplasia to learn more about disease progression? And the second question came from something we hear a lot from patients and research participants. They often ask us, if I have pain on one side, what are the chances I'm going to develop pain and need surgery on that other side? So those were two big motivators for us to do this study. So you can see all the results from the study in the paper, but there were two of the findings that were a bit surprising to us. The first had to do with the acetabular inclination angle. We somewhat suspected that it would be a good predictor of developing pain or needing surgery, but what was surprising is that it was so much more of a predictor of those than was the lateral center edge angle. We think a lot about lateral center edge angle as being the real metric that defines dysplasia, but in fact, acetabular inclination was a stronger predictor of developing contralateral pain and eventually needing surgery. The second finding that was somewhat surprising to us had to do with our results with patients with what's called borderline hip dysplasia. So looking at those patients, we found that if their contralateral hip did have borderline hip dysplasia, they were more likely at 5 years to develop pain than someone who had a normal morphology on that contralateral hip. Again, that's not super surprising, but what's interesting is the rates of surgery were no different between patients with borderline dysplasia and patients with a normal morphology at 5 years after initial hip surgery. We think there are some really important findings that can help practitioners, especially as they educate patients about the prognosis of their contralateral hip. For example, what we found is that among patients who initially have pain and get treated on one side, 50% of those are going to have pain, and about 30% are going to need treatment on the contralateral hip at about 5 years. So surgeons can use that information to help educate their patients and give them an idea of the prospects of both pain and surgery. We also found that the rates of pain and surgery definitely go up with the severity of their contralateral hip bony deformities. So this study helped us understand a bit more about the potential for developing pain and eventually needing surgery at about 5 years after treatment on an initial hip. What we still need to learn about is why that happens. And these are some of the questions we're investigating in ongoing studies. For instance, in patients that have bilateral deformities, why is it that one hip initially develops symptoms or has worse symptoms than the other hip? And after treatment for an initially painful hip, is there something biomechanically that changes that eventually leads to pain on that contralateral hip? Or are there other factors? We've got ongoing studies, and we'll try to have some answers to these in the next few years. So thanks for tuning in to our author insights about our new article. We hope there's some information in it that will be useful to you, and feel free to contact us if you want to learn any more about the study. Thanks.